Welcome, and today we are honored to have with us an extraordinary leader in healthcare. That is Dr. Lisa Tank, President and Chief Hospital Executive of Hackensack University Medical Center at Hackensack Meridian Health. Dr. Tank is a physician leader whose vision is rooted in service, innovation, and a deep commitment to improving healthcare, especially for aging populations.
Promise that this facility goes beyond bricks and mortar to provide high quality, exceptional, reliable patient care to the community.
With a background in internal and geriatric medicine, she has championed patient-centered, value-based care and led groundbreaking work in delirium care, telehealth, and pandemic response. Under her leadership, Hackensack became the first hospital in the nation to receive disease-specific certification in delirium. So, without any further ado, let's talk to Dr. Tank about her journey, the future of geriatric care, and how we can all age better. Welcome, Doctor. How are you?
I'm good. Thank you for having me.
So, since you're talking about those cardiac arrests, and recently we have seen, especially after the COVID times, the younger people are getting, heart attacks, and there is news every day. Somebody's on the floor with a heart attack, cardiac arrest is there. So tell me, at what age should they go and just get their heart checked?
I think, there's never, as I always say, there's no time as anyone can say it's too early to do anything. We talk about pediatrics, we talk about young adults. They should be making sure that they at least have one primary care visit, check your blood pressure. That's one simple thing that you can do. As we know that high blood pressure can cause so much damage throughout your system. I'm not just talking your heart, right? I think that's going to be very important. So having a primary, I'm not saying go to the doctor every week, every month, twice a year, just one good checkup, but you do need to have that. So I think there's never too early to start, and it's never too late to start. So if you're 80, 85, anywhere out there and thinking, oh my gosh, I've never gone to a doctor, it's never too late. You can always go, get everything checked up,
so
and then come
annually,
up with a plan.
basically get everything.
Annual is a good way, and,
Yes.
and I always say this, it has to be a partnership between you and the doctor.
Right.
The doctor can't do it alone. You cannot do it alone.
Absolutely.
And you each advocate for it, and you come up with a plan together. So that partnership and trust is what really helps.
Would you mind sharing few of the lifestyle, everyday lifestyle, changes
Sure.
that can truly make a difference, especially as we get older?
Yes, I mean, simple things. It's not asking anybody to run a marathon, but simple things, right? So if you look at physical mobility, just mobility. So if you look at what do you want to do in your day-to-day life? You're gonna go get your groceries. You're gonna, if you have grandkids, you want to pick up your grandkids, right? So things like that. You want to tie your shoelaces. So flexibility exercises are good things. If you are going for grocery, don't park right next to the store. You can park a little further away, and you can walk. That walking adds up. So as we always say, 20 minutes of good walking is important. You can split it up, 5 minutes in the morning, afternoon, evening, and night. That's 20 minutes. So as you do your day-to-day chores, as we call them activities of daily living, they are important, and you can add exercise into your lifestyle. So, and then you can have an exercise program where you walk, that's your cardiovascular. You can either have bands, resistance bands, or little weights. That gives you strength, right? So what that does, it makes your bones stronger, it makes your posture stronger, your lungs are able to open, you can take nice deep breaths. Then we talk about flexibility exercises, simple stretching and flexibility. So you can tie your shoelaces and you can bend, things like that. So incorporating mobility exercises within your lifestyle, as we say, activities of daily living, is going to be important. And then coming into balancing your checkbooks, or you're doing puzzles, that gives you the mental acuity. As we all know, things that bring you joy are always going to help your cognitive function.
Right.
And don't forget sleep.
Sleep
very,
is
very important. Good sleep. Alcohol is tricky. It does affect cognition, and it can affect longevity. You won't, as you were asking me, right? What's the difference, biological and physiological aging? you don't, as you get older, you don't process alcohol as well as you did as a 20-year-old.
Right.
Definitely.
Right.
Things like smoking, any kind of medication, substance use, that is going to make a big impact on your life and your ability to live with quality. So I think that's an important thing to remember.
So, since you are talking about like staying active,
Yeah.
and these days, like everybody's like, okay, 10,000 steps a day, that is important. So, do you think like, is it good for like 10,000 for everybody, or does it depend on your BMI?
It doesn't depend on your BMI. I think the critical part about it is what is going to be a healthy you. That's going to be important. Where can you function in your ability? And all of us have something. You can have arthritis. So you're not going to be, if you have arthritis, you are going to have some limitations. But how do you cater towards that? And that's where the geriatric program comes in at Hackensack. One of the focus is, as I was telling you, very patient-centered. We want to meet you where you are, and we create that program for you. And the important thing for Hackensack University Medical Center is it's an age-friendly system. So anytime your care moves from outpatient to inpatient, or now you're getting discharged, the focus is always on the 4 M's. We look at your mobility, we look at your meds, we look at what matters, and we look at your mentation. So I think that itself gives you that program that everybody's not going to do everything. But we can do things to make sure that for you personally, to advance and not regress.
Since we are talking about the mental health, especially for our seniors,
Right.
and many people, I feel, as you were earlier talking, they underestimate the power of connection between people, socializing. So tell me, why is like social support so critical? Especially, I'm sure you have a lot of patients there, and after treatment, why is it so critical?
I think social support, human beings are social. So it is in our DNA. It is really important. These kind of things, as I was telling you, things that bring you joy. If you're having lunch with your friends, or your friends are coming over, or you have family that is constantly supporting you, or you're doing have a book club, or you're listening to music, or moving and dancing. All these things release chemicals in your body. Things like serotonin, dopamine. These are happy hormones.
Right.
They take away stress. They give you a positive attitude, and they help you to really be able to keep yourself motivated. And I think that's an important thing. Not everybody's not happy all the time, so that's a misconception. There will be days when you don't feel right and you need a minute to yourself.
But is that okay?
It is okay.
That's okay, because there are some people,
I
if they're
know.
not happy, they're like, oh, I'm depressed.
Yeah, and depression and anxiety are serious things, and we take that very, very seriously when you come and see us. And that's where you differentiate that. If you felt one day you didn't want to go out, you wanted to stay in bed and have a hot cup of tea, and didn't want to talk to anybody, does that mean you are depressed? Probably not, but that's important. But if you have more days like that, and those are certain red flags that are hiding beneath the surface, and that's why I think it is important that comprehensive care, where you look at everything. You can't just look at the heart, the kidney, or isolate a certain thing as you're doing a health assessment. You have to look at the whole picture. And that's a big part of what we do at Hackensack.
Talking to you, I feel that you are like putting a big emphasis even on mobility also,
Yes.
especially. So tell me, like, why is it important, like staying physically that mobile? Why is it such a game changer in aging?
So I think mobility is directly tied to independence. One of the things that, and I know I said quite a few times one of the things, but I think it's an important part of what we do as a team at Hackensack University's Medical Center is really making sure that we encourage you to stay independent. We encourage you to have autonomy. We want you to advocate for yourself, and mobility is a big piece of that. So I was mentioning activities of daily living, and then we have instrumental activities of daily living. These are markers And what these markers are, they help you assess, are you able to function in your life? Are you going to be able to function in the next 3 years, 5 years? And mobility is important, because what does mobility do? Mobility lets you go out and take a walk if you want to. Mobility, as I was telling you, helps you enjoy. Let's say you like dancing and it brings you joy. That mobility will push you to be able to do that. I have patients who love to do line dancing, and that's where they get social stimulation. And that's why we at Hackensack, one of the things we've also created is our wellness center, where we want you to come and swim if you want to swim. Because swimming is a great exercise for mobility. And if you have the right temperature in the water and saltwater pools, that can help you even with your joint stiffness. So creating that kind
Atmosphere.
of atmosphere, you absolutely said it. As they all say, you surround yourself by that positive energy, and that will lift and elevate everybody.
Absolutely. So even, let's talk about surgeries or like treatments. So how do you decide when a senior, an older adult comes to you? How do you decide like what is right for that older adult?
So as you said, proactive management is key. We are always looking at, as patients come to us, is to build reserve. We always want to build reserve, because God forbid, as you said, COVID, it came out of nowhere. Certain folks did well, certain folks didn't do well. So managing and maintaining a healthy lifestyle, a healthy weight is important. And what I mean by is, just because you have a healthy weight doesn't mean you're healthy, right? So making sure that things like your cholesterol, your kidney function, your hydration, right? Those are really important, how much you hydrate. And what all these things do is they're building blocks. And once those building blocks are nice and intact, right? And God forbid now you needed surgery. So one of the things that we have done at Hackensack is, or you had a trauma, you got into an accident, you fell, you broke a bone. Things like that. What at Hackensack we have done is the emergency room itself. So minute you start your care, it's a geriatric certified emergency room. So everybody's focus is very geared towards 70-year-old, 80-year-old, things like that. And what that does is builds on your reserve and takes a look. So there's something called a health assessment or a risk assessment. That's done right at that point, and there's a whole comprehensive team, what we call is a multidisciplinary team. So there's a pharmacist, there's a geriatrician, an internist, and then there's a program called Geriatric Surgery Verification Program. So that gets pulled in. So the surgeons are trained to look at frailty. If you have been healthy and you have the right building blocks, your outcomes will be better. If you were smoking, so if there's an elective surgery, we will intervene much earlier. So let's say you have to have your knee replaced. What would we do? If you were smoking, we would start working on that way early and optimize what we call is your health, so that you have a good outcome. If it's emergency, it's emergency.
But does knee replacement impact your what does it have to do with lungs?
So one of the things that patients who have chronic diseases, right? Diabetes, COPD, let's say you had COPD, asthma, things like that, we want to optimize your lungs. So what we call this as incentive spirometer. It is a very simple instrument that actually helps your lung expand, and it helps you to keep it expanded, and it stretches. So everything is a muscle. You don't use it, you lose it. Everything. Right. So keeping those lungs exercising, making sure your bones are healthy so you don't have what's called kyphosis, right? And that helps you take nice deep breaths, improves your lung function, and the lung and heart are very connected. Right. So we make sure that those two organs are functioning at the optimal level. Everything is about optimization, so that the outcome is good.
Exactly. So basically you're trying to say that if you have the knee replacement done, your rest of your health should be in good condition.
Absolutely, because everything, and one of the advancements of healthcare, as you were saying, is it's moved so long, and it's important where you have your surgeries, because you want to know what kind of anesthesia they're going to use, what kind of sedation, pain management.
Right.
We have advanced with robotics at Hackensack, where it's minimally invasive. So your recovery period is shortened. Your pain management is better, and your function back to your life is much faster.
So that takes care of that. But let's talk about the memory loss, which is like a rising concern right now. So tell me what advancements or efforts at Hackensack give patients hope to fight against dementia.
So again, talking about, as you had pointed out, we want to catch everything early. And we want to create a toolkit for our patients earlier on, where we want to prevent memory loss. So you can do things to make sure that your mental acuity and your memory are intact. So there are things that, it's simple exercises that you can do. Creating all these things we talked about, wellness, they affect your hydration, your ability, your sleeping patterns, your stimulation on the phone, etc. So we want to put all those building blocks. Now there's something called cognitive impairment. That's not dementia, but it is a building. And that's why when you go for your comprehensive assessment, there is something called a screening test for your memory and your acuity and executive functioning. So that is very important. And then let's say that there is dementia. There's either family history or there's a diagnosis now of dementia. Dementia is such a wide spectrum, and there are different types of dementia. So you want to make sure that you have that right diagnosis. And then if there is a diagnosis like that, you want to educate the patient, you want to educate the family. And then there is advancements now with treatments. There are infusions that are available, there are medications that are available, because the goal is really to preserve that quality of life. And even with dementia, how do you still function, and how do you interact with your loved ones? Absolutely. So it's a comprehensive package. There is some that is what we call as behavioral therapies, and we try not to use medications, but then you do have to use medications, and then when it comes down is what are the right medications. So
any vision you have for the future of geriatrics at Hackensack?
So I think Hackensack is highly engaged with the community that we serve. We are also a tertiary and quaternary center. Age is no longer a barrier to receiving cares. And one of the things that we have already done is recruited highly skilled physicians and highly trained nurses. And I'm blessed leading that team. And what they've done is really created an environment. So if you think about the new tower that we have, we call it the Helena Tudor Pavilion. It is created in a space. It's a surgical tower with the critical care and with brand new ORs. And all of them are geared towards creating an environment of healing. So there's light, there are windows. And we all know that when you have light and windows, especially when you're recovering, it helps with orientation and delirium. So Hackensack is on that path to really make sure that our community, if it's geriatrics, if it's young, we take care of everyone. And our goal is to create that entire spectrum. We have a NICU, we have little babies, right? And then we have the entire spectrum. And then you have geriatrics. We have OB, we deliver our babies. And our passion is really about providing patient-centered care. And we want to provide the right care at the right time to the right patient. And as we all say, if you need us, we are there. And our goal is to commit, and we have committed to that journey. And as I was telling you, healthcare is changing every day,
Absolutely.
Right? So looking at the healthcare environment, value-based care is going to be important. We use electronic records, so that's important for communication, because if your doctors are not communicating, that's not right, because it's all about you, right?
Absolutely.
So the physicians are communicating, the nurse practitioners, it's an entire team that you get. And don't forget AI. right?
Hey,
So,
AI
hey,
is
it
here,
is
yes.
here. I know a lot of people talk as we train.
So, talking about
yeah.
AI, how is AI like in the future going to be helping with the medical things?
So AI is already here.
Yes.
It's already incorporated into our electronic medical record. It's incorporated into radiology because just think about it. You had, if God forbid, you had cancer and you had multiple scans. What does AI do? It helps the physician, it helps the provider to accumulate all those input from various scans and then says to you and helps you for shared decision making. So, and precision medicine, what we can do is we can improve our acuity of diagnosis, we can have precision medicine, and all those things are really supporting your clinician to help the right diagnosis for you and the right treatment plan. And this is what we are teaching. We have a medical school, and it's really always brightening when you can take your students and your residents, and I'm not just talking about medicine. We have students in pharmacy, physical therapy, nursing. So it's a multidisciplinary approach that we have at the medical school, and that's creating that future of who's going to take care of us. Because
Right.
as we all know, there is a shortage. So there's a shortage of geriatricians out there. And really creating that environment that they put their trust in us as Hackensack University Medical Center or Hackensack Meridian Health and say, this is where I want to spend my future in my career. And that to me, that's joy.
Absolutely. And I feel you are an inspiration for so many people out there. So tell me what inspires you and keeps you so chilled and, with a smiling face.
It's the team. It's the team, it's the patients, it's what we are able, and I think it's very important that Hackensack and Hackensack Meridian Health has created that platform where you as a provider have the space to mentor or be mentored, to inspire and be inspired. That's been my journey, as I was telling you,
Right.
that I trained at Hackensack, but then I always had opportunities by my mentors to continue that journey. And leadership is something that I don't think anybody decides today that I want to be a leader. It just completely granularly, organically happens. And the key then becomes is, are you there to support your team? Are you there to create that inspiration and that environment for people to grow and nourish? So as I always say, if there is something that connects you and always keeping the main thing will take away the noise and will help you focus on what you need to get done for your team to be successful. And to me, that's what brings the joy.
Absolutely.
So that's a big part of what we do. And we have committed to safety and quality. We are committed to a high reliable organization so we can reproduce. And seeing the team and seeing the outcomes, that's where you find that, I would say, satisfaction of all the things that you're putting into place. And the network has blossomed, the teams have blossomed, and the teams are so committed. We saw that during COVID too,
Right.
that the team is there to help everybody. And I think nothing brings more joy than giving back.
Absolutely,
Right?
giving back to the community.
Yeah.
Absolutely. So I just want you to give out a message to our ITV Gold viewers. Please go ahead.
I think my message, and thank you for giving me this opportunity. And we always take these opportunities as reaching out to a broader audience. Your health is important. Your health drives your goals. Your vision of having your dreams, it's never too late. Really understanding what your abilities are is going to be important. That's why just go to your doctor, sit down with them, have a health plan. I know everybody's worried, oh my gosh, I don't want to know
What's
maybe
going
there's
on?
something.
Yeah.
But it's important to know it. And healthcare has advanced in such a way. So creating that patient experience, we are there to help. We are there to partner. We are there to advocate. And we want to make sure that, we want you to be well, healthy, and enjoy what you have built in all your years you've invested. So I think my message is simple. You matter. be kind to yourself, because what happens between these 2 years, that's noise, is real. And how do you balance that? And how do you create some form of self-care and a balance in a way that you give yourself credit? And you have to tell yourself that, I've done this, I've come here, and I've achieved this, and now it's okay to take a little minute and take care of yourself. I think that's important. That's my message,
It was lovely having you and listening to you. And really, I got to know so many things from you. And thank you so much. Thank you.
Thank you for having me, and thank you for the opportunity. Thank you so much.